Me and you.
Doctor.
Yes, sir.
Bibia ya kama.
Enko ye, sir.
Ede biem.
Enko ye.
Na mudim ade ma akudum wotwa koto abayanim. Na wa fani nyina ma na kanan bia. Ene your problem.
Enyo be ma won say asemba. Obi aka ni de mani ye de. Sir, 29 yeah, kano. Those were things that we were already enjoying. Adiana.
More freely than that.
And I face Diana Fufro Crano. Dia Yebetia a free IGF mono. They quickly agree to it. Because on by more conditions of service, na IGF soa. With the greatest of respect, it is a lot of nothing.
A lot of nothing.
Of course.
IGF.
IGF, when it's subject to the availability of funds, every manager will prioritize operational cost over conditions of service. And so government submitted to us in our previous conditions of service a certain 13th month's salary, which we rightfully deserve. Go around and see how many workers have enjoyed. Unless you are privileged to be working in the big facilities like Kolebu and Co, which generates more and they have capacity to pay. Other than that, it is a lot of nothing. It is like giving something with the right hand and collecting with your left hand. And so those were the things that quickly they agreed upon. When it got to the contentious issues, what should appear on the pay slip so that we can have better pension and the rest, that is where
the challenges.
And we are told that they do not have financial mandate for the rest.
But that is the case. You are dealing with a ministry that does not have the financial muscle. That is the case.
Well, may I respectfully submit to you that will you agree that if that is the case, then everybody within the space of work should suffer same? But when you have, these things...
Selectivity.
This, of course, there is clear selectivity. So we are saying that we are not expecting that the 10 outstanding all should be extended to us. Everybody who have been to negotiation table will know that at the point you trade something for something. And we are willing to do so. What has been the challenge is engaging us even for the conversation has been the problem.
But are you saying, sir, as we speak, there is no engagement ongoing?
Well, if it is today that they will call us, take note that we give ample time, reasonable time, within which duty bearers should act. Because you see, we lead people, and you see the people agitating and calling for a direction. And as leaders, you prevail upon them, say, hey, baby, I'm going to say, Muntumubu. Na failure, Utraya, na failure, say, hey, Minya Jama, could you baby? Entina Tembia, Ukebima, Mosano. Then, when we got to that point, the truck command duty bearers say, young Groffono, baby, I do not yet. One year, baby, I'm from one.
But why are fair to the new minister? Why are you fair to the new minister?
Well,
he just took office.
Well, the point is that it is a continuity.
That is perfectly so, but at least to be fair to the minister.
Award be na lab for a year. So be kwa koji say, only minister. Tisa, ya di sumawa. Ya di sumawa. Sabi pepe leche.
Say oba award be there.
Uncle Beji, and you inherit both assets and liabilities.
When was the last time a sector minister has a relevant bodies in finance ministry fair wages?
No, but even to extend that goodwill to the new minister, don't you think it would have been appropriate if he has invited leadership around, then put in a case? He has not done that.
The new minister?
He has not done that. He has not invited our leadership, even up to now.
Are you sure?
And so how can we extend such privilege that you are a new minister? He should present his case that while I am a new minister, treat me as such. I now know issue and I'm abreast of the issues. Give me time to solve it. He has not done that.
Yes, sir.
Minister no Bibia sense.
Oh, I am sir. Minuka say he has directed say there should be an emergency meeting between the leadership of our unions, management. They acquire a befaswa one, omube call off strike, and secondly, we move back to negotiation tables and Yakotwaso. Ubekaya, last 2 weeks, no Wet Health Assembly, no, he was not in the country. At that time, no, now most of the management members in Nako, including the chief, director, HR, and chief director,
but the urgency of the matter.
But, all right, sir.
You see, the urgency of the matter, no, more approach, more bufu, and how is that?
Oh, a lot of things have gone on, and now because Dr. Ama, we will try as much as possible, sir. We will maintain a cordial communication, but a lot had gone on. We feel, sir, at the meeting now, with evidence as that they will be happy, and then they would call off the strike.
But your minister is still in town, and he's not met them. That's the challenge.
Currently, the minister is arranging for an urgent meeting, and I can say, sir, let's leave it up to this point. Senebeya, yeni omushia, ebia medical assembly, a committee numuna and sharanko sisu. Eti mesre say, ye invitation na eba out no. Na omu ona sa invitation ye ni mushia. Dr. Amanu mushia no ye ni omu kan bibiye wia. Omu ankasa will come out to give a communication to that.
But so when we say space no mojato or gap no mojato, we cannot just fulfill it a year. Gaps is the but so sir.
Of course, there is a lot of crisis in their absence. Sir, we are all suffering it. And you know, a lot of tension at the ministry at the moment. Sir, you send a bayout, you better resolve issue way in temtem. Na, of course, the Omunina Beckans, okay, say, I be a druid. Ya tiwe yase, ya jiwe yatum. Then we come together, send a ye nedano. Yeni omu. We have been with them, they have also been with us. And to your best room, all we can say is, we are begging them, say, Omu, resign Omu decision. And at the table, we believe that they would listen to us and consider that.
But why have we gotten to this point where Omoma duty bearers enough on one west, if I'm to borrow, ample time to ensure somebody may rectify some of these things are avoidable?
Sir, I say some of the issues now more reasonable. Most of them, let me say, it is not resting with the Ministry of Health to give that approval. But
you act as a facilitator, you serve their interest.
Exactly. So we have done a lot. He can attest to the fact that Ministry of Health was always committed into the negotiations. We have done a lot. Just that at this particular point, things have gone the way it has turned out. And so we will call on them to come for the meeting, and then we'll continue with the negotiations. Because negotiations now,
so the meeting is when?
I just got back, and I'm told it will be tomorrow. But I will confirm that when I cross-check, but I'm sure it will be tomorrow morning.
Okay, my name is Dr. Amana Wadaroma. If they cannot take the final decision, they can push, but they can't take the final decision. If you want to consider almost limitation,
rightfully so. And judicial letter come out. You expected say, and to say, how you should be the person we can come to quickly so that you can add your voice. Unfortunately,
approach encouraging.
I mean, the letter they put out there really infuriated our people. Yeah. Why? Because you see, we wrote to them directly, and they didn't write to us.
Oh, they
didn't write to us. We only saw evidence of receipt of our letter
in the news
on the 5th of June.
5th June.
But they never found the need to invite us or to even, write back to us. They didn't.
We're very worried about that.
Of course, our people felt slighted. And whether you like it or not, fairness is a function of effective comparison. They compare. Fairness. Yeah, they compare. That if it were to be nurses or pharmacists within the sector,
don't make that comparison.
Respectfully submit to you.
You are also equally important.
Exactly the point. So our people felt slighted. That why we felt discriminated upon.
In the health center, the money discrimination here, man.
So the paper now you go for no. on my drink or yo. Some more patches a trauma more cry, move fear. And only to see in the public space a certain plea after the strike has taken effect. So it was a knee-jerk reaction. And you know, the statement even they put out there, are you aware that in negotiation, you do not declare the details, you don't speak to the details in the public? It was in clear violations of the rules of negotiation. You saw the Fair Wages and Salary Commission. They didn't mention anything. They only mentioned 29 numbers because they know the rules. They are their masters of their game. So what the Ministry of Health did was in clear violation of our rules. And it was only, and I believe that they cannot claim that they were not aware. It was tailored at something to create a certain disaffection for the medical laboratory professional. And our people were extremely appalled by that action.
Isaac, Nadiana Makofabe.
Oh, I could say, sir, it's but wait, but this particular assertion there, I want to differ. Say the ministry is not discriminating, and secondly, the issues are STT, was in regards to the current another latest discussions we all face at Labour Commission, and so one way or the other, they may not be fair with it, but it was a communication to let the public know. Say one, the decision to grant all those items does not rest.
One response. You chose to drop it in public space. Their attention open.
No, we never drop their letter in the public space. Letter nobody blame and yes, our letter near the it was referring to the communication now.
Of course, but that's what I'm saying, that we have written to you. You choose to rather put it in the public domain instead of getting back to and we didn't come on the way around it.
No, that communication was not direct. It was a strike communication. At that time, none of the strike had already taken effect. And there was therefore the need for Ghanaians to know, say, one, now the decision to grant all those requests was not resting on the Ministry of Health.
Oh, but I think be fair. Clearly, won't organize. Maybe say back and forth. It's a health sector.
Yes. No, currently there is a serious arrangement to engage them.
And
so we only plead that
under Minister Oko and your good self and the entire team. Meaning, so we're a solid team. I don't want to go deeper, but you come across as quite disorganized. Into the multiplication, say more slight here, because most shall say more comparisons there. We are finished in our health sector. It's not healthy for us. It's back and forth. Because you know who cape ya so be she wodum. So what I say, enti misremo mo mananya asem hia na muntimi ni omo nkasa. Ano baba ye ne beboa ma asumdwa baba o be kire say ye ministry no enye na ye we na ye na ye say na omunye say na 29 maza. Go and organize yourself. We are going to go and sin no more. As we plead with Dr. Ama. Dr. Ama,
you bet your way.
Okomami, Okokrapo, the same primary school. And you catch a grub, whom
that is a what you know,
and to so buy a pono cash,
but with the honorable minister, there have been a lot of issues, and so it's been up and down. So I will plead that you give him some time. He will call you. You will meet him personally.
Okay, but me that's it. So but that's we can. While my hope kakra say we the bibia to be trapped, but doctor now shut us ano. But me believe who.
Some musician.
Doctor ma. But me believe who. Oh, me abadi wadi. As a we adwumadi, obi person odi 6 down on 9 on twuma no cry.
Yeah, the microscope na dey adwuma. By a better microphone na see no was any grabber.
Oh wow!
So with the worries of woman.
Oh yeah, I'm telling you, Doctor Poster,
worries of woman.
So nice.
It's one thing that is very important. Say, yeah. And the good thing is that we have both sizes here.
Yeah.
So I'll show sizes. I'll show sizes.
Send me your size.
I'll show sizes. Let me also be able to put them somewhere here. On best follow me. Into where there. Doctor shoot me in champion. The name.
Yes,
the best approach.
Strike will not resolve issue.
The best approach is
just to draw attention.
the leadership now and
so I'll show you how important
it's very important. But the baby ejina no any baby a ujina say the most leadership say between I can say do baby ni so me nai kra no because yeah ejuma then it brings some attitude of if you do not have something in hand, it will be difficult to.
Of course, I understand. What's the problem? You know,
so
the ministry should sit them down.
They should fix the meeting. That is very important.
Let's try and put something.
Immediately. I bet because and Nigeria Kramuti mission.
We are not insulated to the excesses of any strike.
Okay.
Exactly. Nobody's promised tomorrow.
Exactly.
And then you need the same service.
Exactly.
We are not comfortable.
Doctor,
yeah, that's it.
But
Nigeria, na say chance. But
guy.
Come on, the American say. I'm the say doctor. Unim Yenia Okobo.
Yeah.
Okoyo Bia. Nasunya.
Oh, the most refined minister.
Obetimi Ofempa.
The most refined. Most refined. Obuade.
And he minim say we are Abano. So they are all the kind. Fortunately, Obetum. Chair. Waba Betum. And I just read him to the ministry of Jumasity. And they are now hard. And Sabi, we chief director and then Crawford.
Some show a
minister engaged.
Any Brahman. Yes, that's
it. Oko doesn't just close early. I mean, around 9 o'clock, 10 o'clock, what you might call an office crowd because of the Jumasity. And I'm sure, say, Asempano Wakasa. I asked Papa when you Akasa Hankwadi by close day of tomorrow.
Dr. Franklin Amate, first national vice chairman, Ghana Association of Medical Lab Scientists.
Medical laboratory professional.
Thank you.
And then Bibia Kosu has said, and sir, Eddie, him.
Okay, so you try what by bar, Reverend Charles.